Motherhood is all-consuming.
Having babies, nursing, feeling the fear of loving someone that much.
And there's this baby on your chest and boom, your entire life has changed.
It's a privilege of being your child's safest space and watching your heart walk around outside of your body.
The truth is, I can be having the best time being a mum 1 minute, and then the next I'm questioning all my life choices.
I'm Lo Mansfield, your host of the Lo and Behold podcast. Mama of 4 littles, former labor and postpartum RN, CLC, and your new best friend in the messy middle space of all the choices you are making in pregnancy, birth, and motherhood. If there is one thing I know after years of delivering babies at the bedside and then having and now raising those 4 of my own, it is that there is no such thing as a best way to do any of this. And we're leaning into that truth here. With a mix of real life and what the textbook says, expert insights, and practical applications, each week we're making our way towards stories that we participate in, stories that we are honest about, and stories that are ours. This is the Lo and Behold podcast.
Today's guest is so valuable for that kind of those early pregnancy weeks and months when there is so much that we don't know, right? And that we're just not sure of yet. But we also want to be so hopeful, right? And not feel so anxious about all the things we don't know, but we would like to know. Dr. Dallas Reed, she's chief of genetics and an OB-GYN at Tufts Medical Center. She also is a medical advisor for SneakPeak, which is an over-the-counter at-home early gender test that has over 99% accuracy at 6 weeks of pregnancy. Now, you guys know I never found out what I'm having, so I did not take this test, and I cannot personally speak to having that knowledge, but she certainly can speak to all of these tests and screens and things that we can utilize to kind of know a little bit more when we first find out that we are expecting. Dr. Reed brings nearly 15 years of clinical and academic experience rooted in OB-GYN and genetics. She has dedicated her career to helping expecting parents and expecting families navigate the complexities of pregnancy and all that comes over those, 9-10 months that we are pregnant and waiting for these babies. I am so excited to have today's guest in front of you guys today. I have Dr. Dallas Reed here with me today. I'm going to ask her to go ahead and introduce herself a little bit and then jump into the conversation that we're going to have.
Great. Thank you so much for having me. So like you said, I'm Dr. Dallas Reed. I'm a double board certified OB-GYN and medical geneticist. I work clinically in both of those spaces. So I do general obstetrics and then genetics for prenatal indications, pediatric, adult, and cancer genetics. I also do a lot of consulting with genetic testing companies around their products and sort of how to reach patients and consumers and doctors and midwives. And I am a mom of 2, a 4-year-old and an almost 2.5-year-old. So my plate is very, very full, as I'm sure yours is.
It is. Yeah. Have a baby, a little one, probably right around the age of yours, 18 months, almost 18 months right now is my littlest. So I know how full your life is in different ways, but yeah.
Now it's full and it's sassy. There's a lot of sassiness going on in my house. So.
Well, my oldest is an almost 9-year-old girl, so we got some sass in all the ways.
I'll need to talk to you about that later.
yeah, we can maybe do the off air. It'd probably be a good podcast episode too. I obviously was looking into more of you. I was laughing, you guys, before we started because she is not all over TikTok and Instagram and all that. So don't expect to go find her dancing on TikTok. You're not going to. But I wanted to clarify, you said you kind of work in 2 kind of clinical ways. You're still delivering babies.
Yes.
And doing some of that, I'll say like that hands-on with the patient work. And then you're also doing your genetics work as well. I know you mentioned the cancer, things like that, right?
Which is also pretty hands-on. So I'm like 100% clinical with the work that I do at the hospital that I'm at. But yeah, I have a very cool job because I'm the only person in our hospital, I think really ever, that has had the opportunity to like counsel a couple before they get pregnant, take care of them during that pregnancy, deliver their baby. And if there happens to be a genetic condition going on, see that baby in the hospital and as an outpatient, like forever. So that's a pretty cool job. I get to kind of have that continuity across both spaces, which I really cherish and I really always remember as like a very special part of what I do.
And what a gift for a patient too. I mean, this is like small scale, but I worked LDRP. And so I love that I could maybe, like, we'd have an antepartum patient sometimes there for a couple of weeks, and then you deliver them, and then you do their postpartum, and then you send them home. And even that, like, I just got to spend 2 weeks with you, you know, a shift, 3 or 4 shifts a week or whatever. But just that, instead of just 12 hours to deliver you, or obviously you have prenatal, you know, you have a little bit more time than a nurse does with a patient when we deliver you and then go home from our shift. But just that idea for the patient or the client too, of getting to see the same person inside of really big scenario. I mean, I'm assuming if we're talking about continued genetic care and follow-up, like, it's really nice for them to trust the person that's in front of them as they walk through that with their child. So what a gift for them to get that over the years with you too.
It also goes the other way. Like, I'll see a child or somebody in a family with a genetic condition, and then that couple gets pregnant, and then I see them for their perfectly typical pregnancy. There is no genetic condition. There's not a, you know, reason that I would continue to see them afterwards. But yeah, that continuity of both sides of it, I really like. And, you know, I'm really happy that I get to do both.
Yeah, that's really special, I think, for all of you, honestly. Okay, we are going to lean in today to all of your expertise in some of this like genetic early pregnancy stuff. And I want to kind of frame the conversation for some of these bigger questions that a lot of us are at, or I'll say like more typical like questions and myths and things about not necessarily getting pregnant, but once we're pregnant, like the myths about boy, girl, some of that fun stuff that we all certainly walk through. I mentioned as well, I wanted to kind of start with just like some early pregnancy conversation of like, not necessarily what to expect in the like hour by hour, day by day, but just signs of pregnancy, right? Or things that might indicate we're pregnant. Obviously, testing plays into this really early. A little anecdote, but my 4th baby I got pregnant with while we lived in the Netherlands. And so I had prenatal care in the Netherlands up to about 20 weeks of pregnancy before we moved back to the US. And it was an interesting experience because there are I would say a lot more hands-off than the US in a lot of ways, less testing. You know, they do all of the minimums, like the healthy standard minimums, but maybe not as much as we do here in the US. They're not doing 6-week blood tests to find out if baby is boy or girl, things like that. And when I called in and I had taken like a traditional P test to find out if I was pregnant, and I remember calling in like, hey, I'm pregnant. I think I was 7-ish weeks or something when I called. And they're like, that's wonderful. We'll see you around 10 to 12 weeks. And I remember thinking like, but I'm like, don't we want to confer, you know? And their outlook is like, there's nothing you could do right now. It's just like, you already peed, and if you're wrong, it's not that big of a deal. Like, you know, it was such an interesting thing because I remember going back to Kelv, my husband, and I was like, they like don't want to see me. Like, I just have to believe I'm pregnant, right? Like, I peed on this thing. And so I remember doing the kind of classic, like, what are signs I'm pregnant? Like, I peed, right? I can trust this HCG stick in front of me. But it was like, am I feeling pregnant? Like, this is so weird to think I'm pregnant. But so far, no one's really confirmed that for me. Yeah. So what would you, like, what are some maybe like earlier signs of pregnancy? Like if I were Googling, like, oh, you might be pregnant, including, yes, kind of the testing, the things available to us in those earlier weeks.
Yeah, good question. I mean, I think we talked a little bit about how there's so many tools and tests available now that you can find out a lot of things super early. Like, you know, pregnancy tests are very accurate and you can know that you're pregnant even before you missed your period. So people that are really tracking and really trying, sometimes they have no symptoms. They just are like hopeful, and then they take a test and they find out. But other symptoms that people talk about are things like breast tenderness or like larger breasts or swelling of the breasts, obviously missing your period, of course, although there can be like spotting and like light bleeding at the beginning of pregnancies as well, which can be quite confusing for patients, especially if they do know that they're pregnant. Some people may also just start to have like those food aversions, like maybe not necessarily nausea and vomiting right away, but just like don't have an appetite, or suddenly, avoiding certain types of foods that they usually had no problem with. You know, there can be skin changes in pregnancy and, hair loss and those kinds of things, but they may not pop up right away. And then we talked a little bit earlier about some people just know. And like, I don't even think they can say how they know, but they've just done it enough times that they just are like, I feel different. Kind of like admire those people. They're so in touch with their body. Like, I'm not that type of a person, but I have lots of patients that are like, I just know, like, I just feel different. So I think that obviously there's a lot going on at the beginning of a pregnancy and throughout. I mean, your whole metabolism is changing and it's amazing all the things your body does to support a baby. But yeah, some people just know. And I mean, I can't tell them that they're wrong. I believe them.
Yeah, absolutely. It's interesting. Like, again, those weeks of just like, in theory, I knew I was, but also that question of like, is baby okay? Like,
yeah,
not to be too frank, but like, are they still alive? Right. When you're in those weeks where loss is really common. And it's funny, I have a blog post about like early signs you might be pregnant, and like it's a lot, basically everything you just went through. And there's this caveats like throughout it of, hey, all of these could mean you're pregnant.
Mm-hmm.
The absence of them does not mean you are not pregnant.
Yeah.
And a lot of them are also signs of like your period coming, if we're talking about those really early weeks. So it's just this, like that knowingness, like what a gift if you really do have that intuitiveness, because there's really no clarity on the other side of that in all of this, except these actual tests and the blood tests and things we take, because all of these things that you just walked through really can mean yay, nay, or nothing. Like so there's aside from, again, these blood tests and things that we'll get into more too, like there's a lot of just awareness of your body and then just like holding hope, right? While we get through those weeks, because you can't really just say, oh, my boobs are getting bigger, like I must still be pregnant. It just doesn't work. Yeah.
I talk to patients a lot about, we do like a couple of ultrasounds early in pregnancy, and there's a couple of tests that we do. And when they're normal, that's great and reassuring. And then you get into like the early part of the second trimester where you are not nauseous anymore. You're not puking your brains out, but you can't feel the baby moving. And you're like, is everything okay? Like, it's such an anxiety provoking time. And I just sort of warn people at that, those early appointments, that there will come a time when you feel like a normal human being again. And you're not feeling the baby move. It is okay. This is normal. Everything is okay. And, once the baby starts moving, I think a lot of people, they're like, oh, okay, now I know. And then I think pregnancy is full of these, like the grass is always greener moments. I tell my patients this all the time. Like, if you have a bunch of ultrasounds, you're sort of sick of having a lot of ultrasounds. If you get no ultrasounds, you're sort of like, how come I don't get to see my baby anymore? Like, there's no middle ground. And the same thing at the beginning, with the nausea and vomiting. Some people are like reassured by that. And some people are like worried that it means they're not pregnant, or fetal movement. Some people are like, oh my gosh, this baby moves all the time. And then other people are like, I'm so reassured by the fetal movement, or my baby's not moving enough, so there's like, no one's ever happy. Everyone's always elated, but no one's ever happy. You know what I mean?
Yeah, absolutely. It's interesting to actually think about. I do think so many of us, we get to that 12 or 13 week point, or maybe we've seen him on ultrasound, heard the heartbeat a couple of times. And as we should, I want you guys to hear, like, as we should, we breathe a little sigh of relief, like, okay, we've got through this point, right? Where the majority of early losses are happening. Right. And so you should breathe some relief there if you've been really anxious up to that point. I don't want you to not feel that way. Yeah. But we don't talk a ton about weeks like, let's say 12 to 20. I know some people feel their babies earlier, but like where it is this distrust that like, all right, I hope everything's still going good in there. Cause I have no sign, like a lot. I'm sure some people listen to you say you're not puking and all that. And they're like, I'm still puking, but
a lot of people, not everybody,
a lot of people
caveats all around with these conversations.
Seriously. Yeah. But a lot of people do, you do feel better. And so aside from maybe your pants, like not fitting so great anymore, like you just don't have really obvious signs that all is well. And so there is like so much faith you have to hold as you kind of move towards those weeks where you do start to feel fetal movement and you have these other signs. And it's not that first trimester we're talking about anymore. It's that funky in between where you feel good and you just, you just assume all is well. And that's how we want you approaching it, right? Like to trust what's going on in there too. That's kind of
a lot of anxiety, right? Like there's a lot of anxiety, I think, at baseline. Especially nowadays, there's just so much information out there. It's hard to know what is right and not right, and what's just somebody's personal experience, but what is like the typical experience. So I really feel for patients, like they're overwhelmed with information and it almost feels a little bit unfair, and it's adding to the anxiety. And then people have had really awful stories, like it's taken them a long time to get pregnant. They've done IVF a million times and it hasn't worked. And finally it's working, or they've had pregnancy complications, or they've had traumatic births, so I don't want to discount like the place for all of those feelings. Like I do think that they have a place, but we also would like to provide some reassurance in pregnancy when we can and make sure people know that like this is what's normal and, you know, this is what you should be feeling and this is when you should call us if things are not going normal. So, you know, I think there's space for all of that. But overall, I want my patients to not feel so anxious about being pregnant and the pregnancy process. So hopefully we can, you know, today we can provide some of that and hopefully I provide that as a doctor.
Yeah. Well, I was just saying that's perfect. That's kind of like a good segue into, let's talk a little bit about some of the like early testing we can do. And I was wondering if you could just get really clear with us too. Even I sometimes am Googling again, like which one does what, but because now we have like the NIPT test, you know, you still hear quad screen, triple screen, like all these different blood tests and screens. Some people are just mostly like, I want to know gender of baby, and they're trying to do the sex determination. Other stuff, obviously, mostly this is actually for like genetic testing and things going on. So can you kind of explain some of those options that we do have, what those tests do? I mean, I'm assuming most of us aren't going to do all of those. We're going to end up doing like one of them, maybe two. I mean, lots of caveats in there, but go through some of that for us.
It sort of depends. So there's a couple of tests in pregnancy that we offer. One is a fun one, I think, and fun, but also I think really helps people to start to bond with their pregnancy. So that's the SneakPeak test, which you alluded to a little bit. So that's an early fetal sex test where you can do a test at home, a blood test at home, as early as 6 weeks of pregnancy. So to your story, it's like you did just pee on the stick. You do know that you're pregnant. You have not yet had your doctor's appointment because they don't want to see you for another month, but you can find out the sex of the baby, which I think for some people can be really helpful. Even if they end up having a miscarriage, which we know is relatively common, I do think people still feel connected to that pregnancy. And we, you know, a miscarriage is still a pregnancy and you have already thought about the whole life you're going to have with that being. And so I do think it's nice to like have ways to bond with ongoing pregnancies or ones that may not go on. So SneakPeak is available at, you know, Amazon, CVS, Walgreens, Walmart, and you can also SneakPeak.com is a website that has the testing that you can buy that and like walk into your doctor's office, like already knowing something that I think a lot of people really want to know about their pregnancies before. It's usually the first question people ask me, can you tell me the sex of the baby? And I say, no, it's too early, but you can do SneakPeak and then you can find out. So that one is a kind of a fun one and it's not ordered by your doctor. So you can go get it on your own. You don't need a prescription or anything from your doctor. In the pregnancy, there is a test, the NIPT test that you alluded to. So NIPT, it goes by many names, but NIPT stands for non-invasive prenatal testing. One of the products that the company that makes SneakPeak also makes a product called Prequel. Myriad Genetics is that company. The test they make is called Prequel. And it allows you to do screening for the pregnancy for a couple of genetic conditions. One is Down syndrome, which is also called trisomy 21. Two other chromosomal disorders. One is called trisomy 13 and one is called trisomy 18. And then you have the option of doing some other things. And sometimes it depends on your doctor's office, but we can definitely look at the sex chromosomes. The reason we're doing it in the NIPT or the Prequel setting is to look to make sure there are two sex chromosomes. So if you remember from biology, genetic females have two X's and genetic males have an X and a Y chromosome. And so, but there are people that have one sex chromosome or 3 or 4 sex chromosomes. So those are all different conditions. And so we're looking to see how many there are to, you know, understand a little bit more about the pregnancy. There are other things you can do on Prequel that your doctor can talk to you about, sort of like what other things they can offer, but there are other genetic conditions that sometimes can be tested for on that kind of a test. So those are kind of the two you would do definitely in pregnancy. There's also a test called carrier screening, which is one that you might just need to do one time, like through your reproductive years, depending on what has looked at. And carrier screening, Myriad's product is called Foresight Carrier Screening. It looks to see if you and or your partner are what we call carriers of certain genetic conditions. So carriers are people who have a genetic mutation, but they themselves do not have the condition. And when two carriers come together and have a baby, there's a 25% chance the baby could have that genetic condition. So some of the conditions start There could be symptoms in or signs on ultrasound. Some of them, there are no signs. You wouldn't really know until a baby's born if they start to have medical problems. Some of them might not affect newborns, but affect, children, babies or children. And so there is this carrier screening that's available so that couples can know if they have a chance of having a child with one of those serious conditions. And the thing about being a carrier is you probably don't have anybody in your family with that condition, because there might be other carriers in your family, but no two carriers have come together to have a baby with the condition. And so a lot of things I hear from patients sometimes is like, oh no, I don't have anything like that in my family. I'm like, yeah, you wouldn't know that you are a carrier because you don't have anybody in your family with it. And it might be information that you want to know. So the ideal time to do that test is prior to pregnancy, like when you're thinking about getting pregnant in this like preconception period. But a lot of pregnancies are unplanned in this country. And so sometimes we just do that test at the very, very beginning of pregnancy, like when we're doing all the other blood tests.
Okay, perfect. And so let's say someone does the NIPT, because that's like, I would say pretty common now. My last pregnancy, I was in the Netherlands. I'm trying to think of the other one. If I was AMA, like it seems like we're always offering it. If you're over 35, insurance always covers it now. You could tell me more currently, does insurance cover that now for everyone, or is that still maybe dependent on age or risk that you can have that earlier, that NIPT test that is so much more common?
So the American College of OB-GYN, or ACOG, which is kind of the society that creates standards and guidelines and practice guidelines that OB-GYNs and people that are taking care of pregnant people follow, suggest that every pregnant person be offered NIPT. Now, if insurances cover that, very much depends on the insurance, the state, where you are. So some of them, when it first came out about 15 or so years ago, it was really made for high risk pregnancies. So high risk was considered advanced maternal age, which is over the age of 35 at delivery. Patients who had ultrasound abnormalities, like that 12-week ultrasound that you get if there's like extra fluid on the back of the neck, that might be a reason. If you'd had a previous pregnancy with trisomy 21, 13, or 18. So there were some like indications of who was considered high risk. And then as the studies became bigger and they started doing it in more average risk people, they realized it is equally as accurate and helpful in those pregnancies. And so now the recommendation is for everybody. There are still places that potentially do the quad screen. I'm in kind of like a major city. And so most of the practices here, I think, do kind of what ACOG recommends as far as offering it to everybody. Some offices will still do NIPT, but offer part of that quad screen, which is called the AFP, which can screen for things like spina bifida or neural tube defects or those kinds of things. So the practice patterns are definitely variable. Your doctor should be offering you NIPT. So if they're not, you can ask them about, Prequel or NIPT and see if it's something that they are offering. And if not, find out why.
Yeah. Okay. Not to keep reiterating this, we can go past this after this last question. So does the NIPT, correct me if I'm wrong, diagnostic for the things like trisomy 18 Downs that you mentioned, is there stuff that the NIPT does, does it not test for the spina bifida or the neural tube defect stuff you just mentioned? And that's when you could potentially need an additional sort of testing or screening, or am I misinterpreting that?
That was a great question. So we consider NIPT to be a screening test. So a screening test is a test that tells you what are the chances that I could have a fetus with fill in the blank condition. Screening tests are not yes or no. So it's not saying the fetus does or does not have that condition. So oftentimes on the report, you'll see something like a Prequel report will say like a 1 in 10,000 chance that the fetus has Down syndrome, which is kind of like the lowest risk that you can have. Or a 1 in 10 chance that the fetus has Down syndrome if it's kind of a screen positive. So we always want to follow up a positive screen with a definitive test or a diagnostic test. And so there's a couple of options for diagnostic tests. One is called a CVS or chorionic villus sampling, which happens early in pregnancy. And it's where there's a needle that's used to get a small piece of the placenta to look at the genetics of the placenta. There's also an amniocentesis, which is similar, except it's using a needle to get fluid from around the fetus, to get DNA that way. Some people feel like they don't necessarily want to do those tests. Those tests have a risk of miscarriage, for example. The risk is low, but there is a risk. And so they may say, we'll just test after birth. And we do that with blood tests or other sort of normal genetic testing. So we always want to follow up a positive screening test with a diagnostic test. So that's a very good question. The second part of what you asked is NIPT is only looking at those chromosomes that I mentioned, 13, 18, 21, and the sex chromosomes, unless the test is looking at other things, like they can look at deletions or small areas of the DNA that are missing. There's lots of other things that they can look at. It does not look for spina bifida. That is kind of not a DNA test. That's a different type of a blood test. Also, spina bifida can be seen usually pretty well on ultrasound. So ultrasound is also considered a screening test, and ultrasound is also a good test to look for those kinds of things. And then if you start thinking about like other genetic conditions, like genetic causes of autism or genetic causes of the things on carrier screening, that is not detected on NIPT. So that's why, knowing your family history and talking to your doctor about that, that might be a reason for you to get extra genetic testing for yourself or for the pregnancy, as well as doing, that carrier screening early, before pregnancy, ideally, but early in pregnancy as well, because there's no other way you would like know this information unless you end up having a family member or a child with a condition.
Thank you for that. I think that was like what I really wanted to flesh out is that difference between screening and diagnostic, because we do have these different blood tests that look at different things. We have these early ultrasounds, like you mentioned, the one that looks at the thickness back and the fluid back at the neck folds. Like there are a lot of different things, looking at a lot of moving parts, if you will. Yeah. And I think you have patients who are, like, I don't really want to know everything. So what's the least I can do, but still be thoughtful versus like, I actually want every screening that can let us know every possible thing. You know, so I think it's as, someone who is potentially newly pregnant, trying to figure out like, hey, what do we want to know? What's valuable for me and my care team? What if I don't want everything? Like what are some good boundaries, baselines? And then what would be next steps? Too, if an initial result came back that indicated, hey, like, let's look into more. I think sometimes it's just nice to be like, at 10 weeks, this happens. At 12 weeks, this happens. Yes. Depending on who you are. I'm type A. So to me, I like knowing those possibilities. I know not everyone does. So I like clarifying the screens and the diagnostics and kind of when stuff might happen. Yeah. If you are someone who wants these things and or potentially needs them. So
I think you bring up a good point. There's a lot of information you can get in pregnancy. And I talk to my patients about this, that sometimes coming into the doctor's office, like you are coming in to make sure everything is okay with your baby. And essentially our job is to see if there's anything wrong with your baby, right? Like it's such a different perspective, and it can be hard, especially if we do see things or there are tests that come back abnormal, for those two mindsets to kind of find a middle ground. And so I talk to patients about that a lot, especially ones that do have a little thing here, a little thing there, because when we're talking about a fetus, it's all hypothetical. Like we don't have a baby in front of us to tell us exactly what's going on with them or exactly what could happen or exactly what their, developmental course will be like. Like we just don't have that baby in front of us. And so, people who have experienced this, who've had something seen on ultrasound or a little bit of an abnormal test result, they will have these conversations that are like, well, it could be this, it could be this, it could be this. Like there's not a lot of definitive information. Even if there's actually a diagnosis, sometimes there's still not always definitive information about exactly what the prognosis of that will look like. And that can be a really hard place. It can also feel really hard to feel like every time you come into the doctor's office, you're getting bad news. And so I really feel for patients that are like having that experience in pregnancy, and we try to talk about that. But that is sort of our job, is to make sure that you're healthy and the baby's healthy. And if there are things that pop up, to make sure you're aware of them. And that can be hard for people that are kind of like, I don't really need all this information. I think on the other end of that, though, like speaking to people that want a lot of information, I do think it's important for you to know we can't find out everything. Like, even though we're doing all these tests, it still doesn't mean we know everything. We know every possible thing that could happen to a child. We know every possible genetic condition that could affect a child. Most of autism is not genetic. Like that's always a big question about autism. So there's only like a small subset of things that we're actually looking for in pregnancy. And I think that'll get bigger as time goes on, but we're still never going to be able to know everything about what could happen. And so walking into a pregnancy, if you haven't been pregnant yet, or if you have, then you know that I'm right, that you have to walk into it with this air of flexibility because there's just so much uncertainty that could happen. But I really, when I talk to my patients about like SneakPeak and Prequel and these genetic tests, I want them to ultimately feel like they're empowering and that they're giving them information so that they can make the best choices for them and their family, and not just being confronted with a diagnosis without having had any, with a newborn, without having any time to prepare for that or deliver at the best hospital for their situation or prepare their other kids for the situation or whatever the circumstances. Like, I really want people to feel like this information is empowering and helpful and lets them have the right conversations they need to have with their care team and with their family to get the outcome that would be the best outcome for them. So one of the websites that talk a little bit more about Prequel and Foresight and some of these options is called Know More Sooner, KNOW, moresooner.com, which kind of helps with these myths that people have about like, what is this going to do? Or what is this not going to do? It has like real people's stories. I find it really helpful. I share it with my patients a lot so that they can kind of think through like, how would I use this information? Do I want to use this information? And I think in genetics, that's a really important part of what we try to impart to patients is that these things, we want you to know what the test is for and what information it's going to give you and what information it's not going to give you. So you can decide, like, is this what I need right now or is it not? None of these things are mandatory tests. You should know that they're optional. They're done by most people, I will say, but they're still optional. And if you feel like that's too much for me to know, then you should just share that with your doctor so that you can have the amount of information that you feel comfortable with.
That's good. I think, and that's a good clarifier too of, like you said, these are optional. And I would say, this is me speaking anecdotally with friends, myself, and what I've seen from patients more at the point of delivering is it does seem like most kind of, I'll say buy in. I don't love that phrase, but that's what's popping up right now. Buy into the argument of like, maybe this doesn't change what I want to do like with my pregnancy and this baby, but knowing what we know can help me prepare my family, can help us have the best team. Like, I do feel like most people, if they have this conversation with their provider, often land there. And so it's like almost this idea of like, I don't need this information because it doesn't change and I want this baby and no matter what. But if my doctor and the physician or whoever, my 2-year-old can use this info to like better prepare for what's next, then that's valuable to me. So I do think a lot of people kind of lean that way if they have this kind of thoughtful conversation with their provider.
I appreciate you bringing that up because I do think people think sometimes the conversation starts in this place of like, well, you can terminate if, and that turns a lot of people off because they're like, there's literally nothing you could tell me about this fetus that would make me want to terminate the pregnancy. And I think that people should know with carrier screening as well as with the NIPT or the Prequel test, that actually that information is valuable in so many other ways. So for example, let's say you're seeing a general OB-GYN like myself, and your fetus now has a genetic condition, which we've confirmed, that makes your pregnancy a little bit higher risk. You may need to switch to a doctor that is more equipped to take care of you safely and your fetus safely. You may need to get care at a hospital that's able to immediately take care of your baby and not transfer your baby to another hospital 45 minutes away or 3 hours away to keep them healthy and take the best care of them. You may actually want to meet with specialists that will be taking care of your baby after they're born and learn about what does your specialty do? Like, how will you be helping my baby? What are there treatment options available? Are there cures available for what this genetic condition is? There's more and more like genetic therapies that are happening nowadays where we can treat newborns right away if we actually know that they have a genetic condition, like before they have symptoms. So like, that's just how the medical care could change, not to mention what you mentioned and what I mentioned, which is like, maybe I need to prepare my job situation so that I can be in a NICU for a prolonged period of time and, make sure my team is aware. Maybe we can have extended family come closer, or we can go to them so that they can help us take care of our other kids while we're back and forth. into the hospital or back and forth to doctor's appointments. There's just so many things. I mean, you're a planner. Lots of pregnant people are planners. And so knowing the information is really not just for them to decide, do I continue or not continue? I actually think that's obviously a very important decision, but that's like the first decision. And then there's like so many other decisions that you can make knowing this information beforehand versus, it happens all the time, versus having a child with one of these conditions that now you're like thrown into the world of whatever it is. You've never met another family that has a child with that condition. You don't know anything about the organs of the body that might be affected. Like, it's just already overwhelming to have a newborn, but to do it and have not been prepared for it, I think can make it harder.
Yeah, it's a little bit like a personal thing for me. I have a family member who did not know that their child would be born with some like significant medical issues, some stuff that probably could have been caught like on ultrasound and things like that. And it wasn't. And I do think that she would have loved to have like what you were just talking about, like people right away to go to when XYZ starts happening, right? And instead it was this like frantic work of, I feel so alone. Is anyone else out there with a kid like this?
Yes.
Like that type of thing. And that was, I don't want to speak for her, but I think that was some of the hardest parts of the journey was like, I am so isolated in what's going on. And so I'm doing all this work to simply like not feel isolated, let alone, advocacy and all the medical clinical stuff that was going on in that situation. So I do think that idea of like setting yourself up for whatever before baby's actually born can be such a gift to yourself and your family and the people around you.
And even if it isn't something life-threatening, like on carrier screening, for example, there are genes that we know can cause hearing loss that starts in the newborn period or at birth. So, that's obviously not life-threatening. Lots of people have hearing loss and communicate with sign language or have hearing aids or however they communicate. And, even just getting to know another family that has either the parents and the children have hearing loss or they had a child with hearing loss, just like even something like that, getting yourself educated about sign language or how, what the communication tools are that you're deciding to use for your family after that point. Like simple things like that are everybody needs time to process information, and it's hard to process it when you're just like fatigued and have a brand new newborn and like people are throwing medical words at you and you're like, what are you even talking about? Like, I'm just trying to take a nap. So yeah, that's the empowering part of it. Like the information is here for you to use to set things up the way they need to be set up, to talk to the people you need to talk to and like feel as ready for having a newborn as you possibly can.
Absolutely. It makes me think of, birth education, which is such a big thing of what I do. And I'm like, it is not on me to decide what you do with information, but my responsibility here to you, like, should you join my world is I'm going to help. I'm going to give you information. I don't get to decide what you do with it. That's not my job. Yeah. That's your job. But the information to make your decisions, like that's the gift, right? Like that's where this empowerment that you're talking about comes in and go do what you want with it.
It fits so, every pregnant person that walks into my office, they just want to like know what's going on with their baby. As we started this conversation with that, know what's going on with their baby. And they want to do like what the best thing is for their baby. Right. And so I think this is like our way of facilitating that end, right? We're going to give you the information that can help you make the best decision for your baby. So which is not whatever, it may not be the decision I make to the point you're making. Like, I'm not saying we all have to make the same decision, but it is the information you have to be able to do what's best for you.
That's right. Man, sorry, that ends up feeling like really heavy. Okay, most of you are going to have like very healthy, lovely pregnancies.
Yeah.
However, I do think it's so valuable too to like, we also have to speak to like those who don't. And I hate the idea of you feel so isolated and alone and oh my gosh, what's next? Because you are like one of those small numbers, right? It's like that idea of like, oh, only so-and-so bursts XYZ happens. And then the one who's like, well, I'm the 1%. So like, can someone like speak to me too? So I think this conversation is like so valuable so that those who do have the screen or the test or whatever come back and there's a red flag, like that you have some, okay, what's next for me information. So this felt like heavy. Yeah. I think it's necessary too.
But I do want to make a point. I think you're making a great point, and I will reiterate it, that the flip side of these tests is because they are very reliable, the carrier screening and the Prequel and SneakPeak. It's that if it's normal, that should actually be very reassuring, right? The Prequel is still a screening test, but if you are told that there's a 1 in 10,000 chance that your fetus has a particular condition and ultrasound is normal, most people would feel really reassured by that. And most people are going to have normal results, right? And so I think that's a very good point to emphasize, that not only is this helpful to give you information in the case that there is something going on, but also should provide a lot of reassurance that, like, okay, everything, just like I'm feeling fetal movement, just like my ultrasound was normal. Okay, we've checked this box. This test is normal too. So we're continuing on with like a normal pregnancy, and that I can have another sigh of relief now after that.
Definitely. We could be quick to focus on like the hard thing, right? And you're like, well, what about like all the people who take these screens and tests and they're like, woo, great, amazing. That's what I wanted, right? Like that's going to be most people. And that's like also the gift of screens and tests is they say, hey, everything's great. And you say, thank you, Lord, or whatever. And you move on. And then like, that's also why these are so valuable and helpful too, for sure. Okay, man, I wanted to talk to you about like pregnancy just for fun, like some male, female myths. We probably shouldn't go down all of them because there's like 700 myths, but I want to throw one in front of you because I know with your work in screening and stuff, you know all the things about all of these myths. And I'm talking about, you guys, I'm talking about like, I have heartburn, the baby has hair, just like stuff like that. But again, when I was in the Netherlands, I don't know why it's specific to them, but at my early ultrasound, we never wanted to know if we were having a boy or a girl. But she started talking about like, we can look for the nub. Do you know what I'm talking about? The nub theory, where you can look on ultrasound and see this little nub on them. And depending on the angle that it's pointed, it tells you if it's a boy or a girl. Have you heard of this one?
Is this nub like in the region of the genitalia? Is that what you're talking about?
It's the angle of the nub, like their genital tubercle. And apparently like around 10 to 12 weeks, you can see it. And there's an angle. And if it's like more angled up, it's going to develop into a penis. And if it's straight, that means it's a female. And she started talking about this, and my husband, Kel, and I were like, what are you talking about? Which basically I just logged it in like more of these ridiculous myths and wives' tales that we all love. But is there, I'm going to ask, maybe this is an annoying question, like any science to like any of these myths, or the ones we all like really flock to say, it's a girl, it's a boy, or any of those?
Yeah. So that one about sort of what the anatomy looks like at a certain gestational age. I'm not someone that does ultrasound all the time, so I wouldn't be the best person to answer that. Although usually they can't really see fetal sex until like 14 to 16 weeks on ultrasound, but there could potentially be like something suggestive. I definitely wouldn't take that to the bank or like go purchase your nursery room decor if it has a particular theme that is, related to being female or male or something. Just wait a little bit longer. Or you could do SneakPeak. You could have done SneakPeak at 6 weeks and then you would have already known. But the other ones that are not really. I mean, I've heard a lot of them, like the how high or low the baby's sitting, or, if you have acne or not, or sort of the Chinese calendar one, I think I've heard of. I mean, there's so many ones. I tell people, I used to say it's 50-50, although like I talked about, there can be 2 sex chromosomes or 1 sex chromosome or 3 sex chromosomes. So there's kind of different things there, but we don't know. It's not determined by any of those things. The sperm is actually what determines the genetic sex of a pregnancy typically. And so I just say, ask him. What do you think? What do you think?
It's your fault. Like,
it's your fault.
It's
your
you
choice.
did it.
Yeah. Yeah, but the sperm is what kind of contributes either that second X or the Y. And so that's how the sex is determined. And I think they're fun. I don't have any problem with patients like talking about that. Even the heartburn thing, and you have heartburn, that means your baby's going to have a lot of hair. I mean, there's no harm in like talking about that stuff. I don't think it's true. And SneakPeak actually did a survey with an organization. I'm trying to remember the name of it, Talker Research, to like think about these, like talk to people about these myths. And they found that 30% of people thought the heartburn meant that the baby has a lot of hair, that 20% of people felt like spicy foods could induce labor, that people thought that having sweets meant that you were going to have like a boy or a girl, and it was kind of mixed. So, when you ask people what they think, it kind of like evens out at the end of the day. There's not like one myth that moves the needle one way or the other. And, I think that they're fun, but they're not really based in biology.
Yeah. Yeah. Which is what we don't want to hear, right? Because it's fun to think it's true.
Yeah. I mean, it's fine.
But it is. I mean, and like you said, it is fun. And we've never found out. We have 4 kids. And so it was always fun. And I will tell you, like, we ended up with 3 girls and 1 boy. And like my pregnancies did the opposite of the wives' tales for like who was in there. Like it was never clear. I had intuition one time of what I thought, like it was to me. I'm like, guys, you're all crazy. You don't know what's in there unless you've taken these tests. Like you don't know what you're talking about, which also feels like this population of people who aren't finding out is pretty small anyways, if we're talking specifically about wives' tales related to male or female, because most people are finding out. So I always felt like I was in the minority anyway of being 30 weeks and still being like, ooh, I wonder who's in there. Yeah. I just pulled up the document that you mentioned, or the PDF that they put out with like the different myths and numbers and stuff. And this one is so interesting to me. It says the myth is that mothers are better at sensing baby's gender. And actually they found that dads were more likely to guess correctly than moms. The numbers are not huge. So dads guessed correctly 70% of the time and moms correctly 63% of the time. But I just find that really interesting because we started this conversation about like intuition and I'm like, maybe we're not so good at this.
This wasn't part of the study, but I personally feel like siblings are the best. Siblings are the best guessers. I have no idea why, but they, like I've had so many patients that are like, my son was like, didn't even know I was pregnant, was like, I want a sister. And then now I'm having a girl. And maybe that's also just coincidence, but I do think siblings are pretty good guessers too.
It's the whole conversation is, it's just pretty cute, I think, in my opinion.
Yeah.
Okay, well, why don't we wrap it up right there? I think I wanted to end on some more fun stuff. So that's perfect.
I know we got so serious there for a second.
We did. Why don't you, I know I mentioned when we started that you're not active on Instagram or TikTok or something, but is there somewhere people could like find you? I know you've mentioned some resources and stuff, like remind us what a few of those are before we wrap this up.
Yeah. So that early sex test is called SneakPeak. You can go to sneakpeak.com to see more about that test. You can buy the test there, or like I said, at different retailers. The other website that I think is really helpful about thinking through some of this genetic testing that can be done prior to pregnancy or early in pregnancy, like Prequel and Foresight, is called knowmoresooner.com. KNOW moresooner.com. And Myriad Genetics is also a good website. That's an overarching company that has both of these products, and they're always coming out with sort of new and interesting things to help people get more information and empower them to do what makes the most sense for their family.
Okay, perfect. And then I ask everyone when I end the podcast, one thing in your life right now that's just bringing you a ton of joy. It could be anything: book, food, your kid, anything.
It's a good question. My kids, of course, because they're at very fun ages, 4 and 2.5. My 4-year-old just started preschool. So it gives me joy seeing how excited he is about school. I get no information out of him, 0 information. I asked him the first week of school, I said, what was your, I know not to ask yes or no questions. I've heard that. That doesn't help you. But I asked him, I said, what was your favorite part of the day today? And I thought that was a pretty easy question. And his answer was the sleeping. He liked the nap time.
Yeah,
and then I said, what did you have for lunch? Because they give them lunch at school. And he said, I don't know.
It's funny. My
here we go.
He's 4.5 and he's the same. And he's my boy. And not to say like boys never talk, but it's been different than my girls so far. Because it's like, did you play with a friend today? Which friend? And he's like, I'm like, buddy, you've been in there for 3 months. Like, are you saying you don't know anyone's name still? Like, I don't believe you.
I'm like pulling for straws here. So I like that he really likes it. I like that my daughter, because they did everything together, like up until school started. So I like that she's kind of like getting her own things going. And, we're in this like fun age where we just get to see them like learn and become little people, which is so cool.
It is. And I have kids a few years older than yours, but it's fun. It changes and it looks different. But having my older kids who talk to me a little more, it gets, I don't want to say it's like more fun or better in any of these seasons, but it just changes and it continues to be just the coolest thing while they become who they are. Yeah. It's really cool.
Yeah.
Well, thank you so much for this conversation, for your time. I love getting into all of this stuff. I just think it's so interesting. This season that we're in, it's like so brief, right? When we're pregnant, but then there's just so much going on in these 9-10 months. And so I love having these conversations. So thank you. I'm sure it will be super valuable to so many people.
Thanks for having me. It was a good time.
Thank you so much for listening to the Lo and Behold podcast. I hope there was something for you in today's episode that made you think, made you laugh, or made you feel seen. For show notes and links to the resources, freebies, or discount codes mentioned in this episode, please head over to loandbeholdpodcast.com. If you aren't following along yet, make sure to tap subscribe or follow in your podcast app so we can keep hanging out together. And if you haven't heard it yet today, you're doing a really good job. A little reminder for you before you go. Opinions shared by guests of this show are their own and do not always reflect those of myself and the Labor Mama platform. Additionally, the information you hear on this podcast or that you receive via any linked resources should not be considered medical advice. Please see our full disclaimer at the link in your show notes.